Hey, you are listening to MedikaTalks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss management of pelvic organ prolapse with our expert Dr. Sarita Nayak, who is a consultant urogynecologist and vaginal surgeon, director of urogynecology and gynec laparoscopic clinic, founder of Women for Women Healthcare Initiative. She's attached to Hinduja Hospital, Vocard Hospital, Cloud9 and Surya Hospital. Surgeries like TVT, TVTO, surgeries for pelvic organ prolapse, sacropenis fixation, vaginal meshes, female incontinence are her area of interest. She has been invited faculty and speaker at national and international conferences. Hello, Dr. Sarita. Welcome to our podcast for patients, caregivers, and healthcare professionals at MedikaTalks. Dr. Sarita, can you tell us what is pelvic organ prolapse?
Pelvic organ prolapse is a condition where the pelvic muscles of a lady they become weak, and because of the poor strength the pelvic floor cannot support pelvic organs. Pelvic organs being uterus, bladder, which is urinary bladder, and rectum, they start descending down, so there is a dragging feeling below, and these organs slowly over a number of years they start slipping down. Initially they may just give a dragging sensation, but slowly the lump start becoming visible at the opening of vagina, and this condition is called pelvic organ prolapse.
Who is at risk of pelvic floor dysfunction?
Women who have delivered children, given birth normally through vaginal route, especially who have had a very hard labor, prolonged labor which lasted more than 10 or 12 hours, a big size baby, a baby weight more than 3 or 3.5 kilograms, use of forceps and any instrumentation during vaginal delivery like vacuum, or a very forceful delivery. You know, last time, how long back people used to really push very hard, give pressure from the abdomen. These are the women who are definitely at a greater risk of developing pelvic floor dysfunction, including pelvic organ prolapse and even urinary incontinence. Apart from that, as you grow older, no more hormones in body, the strength of pelvic muscles go down. So, increasing age, menopause, chronic constipation, chronic strenuous work, chronic cough, any condition which keeps on giving pressure on the lower part of your body, that is vaginal area and pelvic floor, predisposes a woman to develop pelvic organ dysfunction or pelvic floor dysfunction.
How is pelvic floor dysfunction diagnosed?
Pelvic floor dysfunction can be picked up very early if a woman is aware about her body. Most of the time, we see women ignore a lot. They don't focus on the symptoms what their body is telling, and they keep denying and delaying attention to these body parts which needs their due regards. So early signs can help us to pick up pelvic floor dysfunction much earlier, like urinary issues, repeated urinary infections, poor flow of urine, poor bladder control, inability to reach toilet on time, chronic constipation itself, and like I said, that bulge at the vaginal area, that there is something which is coming out of vagina. These are the early signs. I think it is time now that our doctors make it a routine to ask these questions proactively, because women don't open up by themselves. So, on a routine post delivery follow up, once you have delivered normally and you visited the doctor at least once post delivery, inquiry into these things can help us to pick up these problems much earlier, and then they can be helped in a much better way.
What are the treatment procedures of pelvic organ prolapse?
Treatment for pelvic floor dysfunction, the first and most important technique or the treatment is pelvic floor therapy or exercises. Now, these exercises are very simple to be done, and a woman can do these exercises even at home. But how to do them and to do them correctly is so important, because if someone ends up doing them reverse, it will do more damage. These exercises are called Kegel's exercises. A lot of material is available on internet about how to do them, in which position to do them, but the best is if you learn it from your gynecologist or a urogynecologist who are the specialists in this field, or a pelvic floor physiotherapist, because we do internal examination while you try to squeeze your pelvic floor muscle. Right technique is very important, and doing regularly, consistency and compliance is all the more important, because doing it just for a day and then leaving it will not help. So it need at least 1 month to start the effect to become visible, and a consistency of 3 months and 6 months, and even a maintenance, doing these exercises for future life also will only keep pelvic floor dysfunction in check. Once the condition is very bad, already gone beyond stage 3 or stage 4, grade 4, where everything is coming out and symptoms of urinary leakage are also there, then many times we have to resort to surgeries. Surgeries for pelvic floor dysfunction has to be done by a specialist who is trained in these surgeries. They need extensive work in pelvic floor. Sometimes we have to push the uterus back up and fix up it in its right place, and sometimes it may need uterine removal. The bladder needs to be fixed in place, the rectum has to be pushed up, the vaginal opening is to be tightened, and at the same time, we need to preserve sexual function also. So the surgeries are elaborate and they need specialist opinion before somebody go for it.
So, what are the advantages in treating pelvic organ prolapse?
Pelvic floor problems, they create problems in quality of life. They are not life threatening illnesses, but they affect a woman on daily basis. The person is not comfortable, stops going out, don't know who to talk about, to who don't know who to talk to about these issues, don't know where the help is available, and slowly these conditions they progress, and women may suffer in silence for years while the treatment is available. So definitely there is a big advantage if a woman speaks up. Go ahead for asking, is there a solution to this problem? And you will be surprised that yes, the answers are available. So improvement in quality of life, making a woman more comfortable, where her overall mental, emotional, physical health improves, is so important. And therefore, pelvic floor rehabilitation, therapies, and treatments, they should be a part of a postpartum program, post delivery healthcare checkup program. And definitely, it helps a woman to re establish and rehabilitate in her own lifestyle, to get adjusted with the body changes which the motherhood has imparted.
When should a patient consider going for surgery?
Well, a patient can choose surgery while discussing the symptoms in detail with the doctor. It may take a number of sessions and a number of consultations to come to a conclusion where a woman will like to go ahead with a surgery for urinary leakage. For example, a condition called stress urinary incontinence, where a person leaks urine while she coughs, sneezes, laughs. Now, we have seen women spending their lives number of years in these conditions without thinking that there is help available, and it's not normal. So slowly, when the problem is small, they may spend years and years. When they decide for the surgery is when they have it enough, when they are fed up of putting pads all the time for urine problems. Even after menopause, they're using it now on daily basis for urine leakage. When repeated urinary infections, they start surfacing up because of these pads. When they find it socially embarrassing, and when it starts affecting their personal lives, the sexual life, these are few instances where they start seeking help for. And surprisingly, they take a long time to take a decision whether they will like to go in for surgery or no. While the surgeries are available and are very well indicated in cases where this is affecting the quality of life significantly.
Dr. Sarita, what message would you like to give to our listeners?
My single message to all the women is that give due regards to your body. Listen to the body when it is telling you that you're tired. Listen to your body when it is giving you symptoms of urinary issues, repeated urinary infections. Listen to your body when you feel something which is trying to tell you that something is coming out down below. We ignore a lot. We ignore our tiredness, we ignore our symptoms, we ignore our fatigue, physical fatigue, emotional fatigue, mental fatigue, and we keep running in the routine work of the day. And there comes a day when the symptoms are beyond our control. Second thing which I want to tell them is that to speak up, to ask, to check. There is a lot of information available on internet, Google. Now, not all the information is right because it scares you to hear that everything is cancelled. But it is important to be informed. So, asking a right person, asking your healthcare facility people, your doctor, your colleagues, at least sharing your symptoms and checking with people that whether it is normal. And you will realize, no, it's not normal, and the woman sitting next to you might be having the same issue. And she might have got treated as well. And lastly, that take an expert opinion finally to come to a conclusion whether you need a surgery, whether medicines are available for a condition, or whether there are some simple pelvic floor exercises which you can do on your own or under guidance. So, at least for pelvic floor issues, talking about it and breaking the taboo helps a lot. And this taboo, breaking this taboo means breaking taboo for their sexual needs, desires as well. Because pelvic floor plays an important role in your sexual and personal life and interrelationship issues. Thank you.
Thank you, Doctor, for being a part of MedikaTalks and sharing your insights. We are hopeful that this informative talk has enlightened our listeners.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.